paper, a bit of a walkthrough. This is the one on neurobiology and behaviour. Apologies for any gaps and omissions. I've pretty much spent my entire career trying to avoid learning anything about the brain whatsoever. Anyway, easy starter. Identify regions A, B and C, and even I know these. So A is the cerebral cortex, and you can see that this is AO1, it's only going to be one mark. Very limited AO marks available. B, cerebellum, favourite area of brain, love it. And C, medulla oblongata. Give it its full name. So I know that on the some of the PowerPoints it just says medulla, but what it means is medulla oblongata. So then we come on to a bit of information. So we've got some deaf adults in the UK who use British Sign Language. It involves movement of the hands, body, face and head. So already I'm now thinking movement, I'm thinking motor areas. Some people are born deaf and others become deaf during their lives. There are many causes, including damage to the auditory nerve between the ear and the brain. Positron emission tomography, which I'm guessing you've learnt about, uses radioactive tracers. There's a PET scanner at Cardiff, and the image shows the results when a hearing patient was giving tasks. So we've got hearing words, speaking words, seeing words, thinking about words. We've got low activity and high activity. So when we give somebody that can hear tasks associated with language, these bits light up, seeing words, hearing words. We've got some motor bits for speaking words and thinking about words there in the cerebral cortex. So I now need to think, well, what do I know about these areas of the brain? What are they called? So I've got this area here, that's the occipital lobe. We've got high activity there for seeing. We've got thinking about words somewhere in the cerebral cortex. I'm going to call that the cerebrum. Speaking words, we've got the motor cortex. And hearing words, and this is where we've got auditory areas here, and we've got Wernicke's there, and we've got Broca's area there, and they're all lit up like Belisha beacons. Okay, so explain why a PET scan would be suitable for investigating activity levels, and an MRI scan would not. So we're going to need to say something about each, and obviously again this is pretty much AO1 stuff. So what does an MRI scan? MRI scans show brain anatomy, and PET scans show activity levels. So the MRI, why would it not, wouldn't show active areas and relating it back to language, relating it back to the question, as language is active. So all it would show you is a still picture of the brain. Okay, so again, apologies, I'm still suffering, afraid. Refer to the image of the PET scan. Direct instruction and your knowledge of brain regions involved in language. Suggest and explain how the PET scan of a deaf person actively using BSL would compare to a hearing person. So, what are we doing? Broca's area. So we'd expect that to be about the same because they're both producing a language of, obviously they're different sorts. So Broca's area, so let's look at the similarity first, would be the same as both are producing language. Let me think, right, okay, so motor area that's lit up down here is, as I recall, it goes from sort of legs to face, so, but actually that area will be a bit higher up, and there'll probably be more activity in the motor cortex because they're using their hands, so they're using movement. So a deaf person's scan would show increased activity in the motor areas as movement is involved, and also of course they have to be seeing, so there would also be increased activity in the occipital lobe. And seeing movement involves the occipital lobe, so there would be more activity there. And as there is no sound detection, there would be less activity in the auditory area of a deaf person. Okay, so moving on to just two medical details. So again, direct, this is an instruction, I want two details that would be needed when interpreting PET scans from patients with hearing problems. And this was actually, certainly the ones that I marked, answered quite well. So it's the age, when the person became deaf, they're born with it or not. And obviously there are different levels of hearing loss. So the level of hearing loss. So are they actually hearing anything or absolutely nothing? And possibly the reason for deafness. So that one was quite easy. So just to give you a heads up, here there were 2 marks for AO2 and 3 for AO3, where you were drawing together lots of different bits of information, and this is AO2, sort of thinking and explaining. So, explain why PET scans of adults with total hearing loss reveal activation of regions of the cortex related to hearing. So they're not using it for hearing. So what does this relate to? This is neuroplasticity. Means that new connections have been formed. And the auditory cortex is involved in BSL. We can use that because it's been told to us that we can use it here, British Sign Language BSL. We all know what BSL now means. To interpret BSL interpretation as it is near to Wernicke's area. So that interpretation is, sort of spreading and forming new neuronal connections. And again, there's one AO1 mark, knowing the term neuroplasticity presumably, and one AO3, 2 AO3, relating that to this new situation.